Hi there. I'm Jim. I'm talking about one of the hospice providers that covers our region. Um, they're called Unity Hospice. And what's very interesting about Unity Hospice and in the area that I'm working in, living in, and in the area that they cover is that they cover 13 counties, mainly 11 large portions of 11 counties, but they have smaller slivers in the two of the surrounding counties as well, um, which is it's actually quite a bit of a span. In the area that I live, I'm in northeastern Wisconsin, and they actually cover the edges of Lake Michigan and the Green Bay actually, because they go all the way up in the Door County. They even serve, it's called Washington Island, which is a large island that has a smaller community that lives on it. Um, and they have to cross, the Green Bay by boat to get to the Washington Island, or they can fly there obviously, but they can't just get in a car and drive there, which I just think is interesting because Unity Hospice, in talking with Melissa, actually was her name, and doing a little research online as well. Unity Hospice is actually one of the first hospices to provide care for individuals in our state and in our communities. I believe it was like 1979, or late mid to late in the 70s anyway, that they started providing care. That Unity Hospice grew into such a success that they kept enlarging their provisions and getting volunteer group works and getting the LPNs and the nurse practitioners and the RNs and social workers to develop such a team atmosphere, to be able to provide for the communities that needed it. There are other smaller hospice care facilities or representatives within our area, but Unity is the largest and one that really takes pride in their work for caring for the families. Some of the really other interesting details I had found out about Unity was that they are locally owned, and like I said, they had started early in the mid to late 70s. But they also operate as a nonprofit organization, and through donations and fundraising and all of those things, federally funded grants, they've been able to provide over 45 years of palliative care and hospice care, and grief support. Another thing that they provide that I thought was really awesome was just the supportive care management team that they have. It's not just hospice care, and I looked at a really great slide that they had on their website, and Melissa had talked about it as well, in touching on it. But what I pulled from both of those sources is that the supportive care management is they have some of what they do is coincides with hospice care, but it's just on a different level. It's more for the chronic illnesses. It's more for treatment of patients that are going to be living longer than the 6 month time frame that hospice kind of is what recommended, 6 months and under. The supportive care management is kind of going over that, above and beyond that, which it all they all looking at my notes, they all include attending providers, which they just oversee the symptom management, nurse practitioners and registered nurses. Both of those, they either manage or assess the ongoing health needs and manages the disease and symptoms of the patient that they're currently serving. They also have social workers, which provide emotional support, and they allow connection for the individuals that they're serving to the resources that they think they may need. They will be able to instruct them or to kind of show them the way to get hooked up with grieving services possibly, or better care management that they may assisting for medical needs. And then also they have a chaplain, which in one of my personal opinions is probably one of the more important things to have in looking at hospice and supportive care management, because um, offering spiritual support, whether depending upon the beliefs of the individual, I just still think it's important. However, you can get the client to reconnect to their spiritual beliefs. A chaplain, that's what they're made to do. And one of the most endearing things that you can have is a moment of peace in spirituality at the end of times, when individuals can feel comfort in knowing that they're going home to their God, to their faith-based beliefs of what that end of life looks like, and that whether it's eternity or coming back, it's just important as for a chaplain to get that individual back to where they need to be for the acceptance of death. Another really, really cool thing that I enjoyed learning about Unity Hospice is that, I mean, obviously I said before, they have a very large volunteer-based programs. One of the programs that really interested me was a veteran-to-veteran program. These are veterans that sign up to go and visit with other veterans who are on their deathbed, or just need the care and just need the inspiration, and really just need somebody to talk to for the support, emotional support and spiritual support, from coming from somebody that's done it, who's been in it, who knows what it's like to be a veteran. Maybe they've seen some wars, maybe they've just been on the other end of that, and been through the training and going through some of the understanding understanding the military aspects of it and having that mindset. I just think it's important for veterans to be just treated with respect and the dignity that they deserve, and being honored in the way that they need to be honored. And I believe that the veteran program is just a simple yet magnificent way to be able to spark interest and be able to keep a veteran in check, knowing that they are thought of, that they're thought of, they're loved, they are just beyond measure just grateful for their services that they have done, and that their services aren't forgotten. One of another key thing with Unity Hospice, they serve the 13 counties, stretching. It's like it's a couple 100-mile span, traveling through the roads and stuff. But like I said, they have a great support group, a great volunteer group, and great supporting staff. But one of the really cool things about Unity Hospice is that they are anchored in De Pere, Wisconsin. They have their main headquarters there in De Pere, and they actually have a place that's named after some very important individuals that started Unity Hospice. But the Jack and Ingrid Meng residence allows people that may not want to be at home or don't have a place to go, but they want to have the community kind of surround them at all times, and they can go on to this residence that's located on 34 acres in De Pere, Wisconsin, and be able to have the care that they want, that they deserve, and also to never feel alone, never feel any anxiety of being alone in their own home. So just some really, really cool things that I learned about Unity Hospice. They go above and beyond to serve the communities that they are within, and that's saying something when you've got 13 different counties that they're serving. That's quite a large span, and to have the individuals that have such compassionate care and persistence to just provide the services that they have, that they offer, is quite phenomenal and quite real. And I'm really just super excited to work with them in the future, as they are as well too, because they do seem to want to offer ways to work together with funeral homes and other hospice care providers alike. So they truly are a service to the community, and I'm looking forward to working with them in the future. Thank you.